Hello everyone, welcome back to Patient Knowledge. I'm Dr. Kirmani and today I'm going to be talking about an infection of the liver called as hepatitis C. So let's get started. What is hepatitis C? It's a viral infection of liver and many times it is discovered or detected accidentally during the routine blood tests. Many people are unaware that they have this infection and they are called as carriers. Carriers can spread the infection in the community. Now, how do we acquire this infection? Hepatitis C can be transmitted through infected human blood, and the modes of transmission can be a needle stick injury in healthcare workers, sharing needles with infected IV drug users, contaminated instruments that can be used by the dentists, or by tattoos and body piercing. Now, what happens when you are infected? The virus causes mild flu-like symptoms when it enters your body, and you may feel a bit tired and have fever. Now, when you recover from this illness, the virus will still remain in your body and initially does not cause any serious problems. And many people are not even aware that they have this infection. They are called as carriers. However, they can give this infection to others. This virus can stay in your body and can cause chronic infection and can gradually affect the liver, which takes about several years to develop. Now, initially, the liver cells may become inflamed or swollen, and this stage is called as hepatitis. Later, liver cells will get damaged further and shrink, and this is called cirrhosis of liver, and the liver becomes hard. Eventually, it can cause liver failure in a few cases and also can cause cancer of liver, which is not very common. Now, this is an explanation about how the hepatitis C affects your body. It can cause flu-like illness when it enters your body, then it can give rise to hepatitis when the infection becomes chronic, and there will be some swelling of the liver cells in hepatitis. Then over a period of years, it can cause further damage and the liver cells shrink. This is called cirrhosis of liver. And only 5% of people may develop liver cancer. Now, what to do if you are hepatitis C positive? So if you are found to be hepatitis C positive on routine checkup, then you have to inform your dentist, doctor, and other close contact if you are a carrier. You shouldn't be donating blood. You should not share any personal items like razors and toothbrushes, and do not share needles. Always cover any cuts and wounds with a firm dressing, and your blood spills must be wiped with household bleach. Safely dispose of blood, stained tissues, tampons, and pads. Now, how is it diagnosed? Well, most of the times it is diagnosed accidentally through routine checkup. With a liver function test, just a blood test of the liver, may show liver enzymes are elevated. Then the doctor may do further tests to confirm the diagnosis, and this test is specific for hepatitis C. It's called as hepatitis C serology or PCR. If that is positive, then the doctor will refer you to the gastroenterologist who will do the liver assessment for you. The specialist may order a liver biopsy, and this is just a test where a tissue is taken and examined under the microscope. Now, this is important to check the extent of damage to the liver cells so that the doctor can plan your treatment. Now, what is the treatment? Here, the good news is hepatitis C can be treated with antiviral drugs and interferon. Rest if you feel unwell. Take a healthy, balanced diet and should not smoke. Take alcohol in small amounts after recovery, and stay in contact with your doctor, who will advise you about the most suitable drugs. There are some important facts about hepatitis C. The family and friends of the person who's infected with hepatitis C can be reassured that it does not spread through handshake, hugging, or kissing. However, it can spread by sharing razor blades and toothbrushes. There is no vaccine available yet, so prevention is the best cure, and all carriers have a responsibility to inform their doctors, dentists, friends, and healthcare workers to prevent the spread of this disease. So that comes to the end of this video. I hope it was helpful in understanding hepatitis C. Thanks for listening. If you like my video, like and subscribe to my channel, and every week I'll come up with videos that are related to health conditions. You can also let me know if you wish to hear about any condition. Just leave it in the comment box below. Bye for now.